Good morning and welcome to Super Healthy Super Mornings with Dr. Shilpi. Today I wish everybody a very happy Durgashtami. It's the festive time, festive season, and I know everybody must be busy, but then as life goes on, we have yet another interesting topic to discuss today and to promote natural birthing, normal deliveries, and to encourage pregnant women to deliver normally. There is ages and ages of information around normal delivery that it is the one that you have to encourage, and it is the one that your body friendly outcome of pregnancy. But then still, the recent generation is going against this kind of a normal phenomena and opting out for operative deliveries. But then I tell them that operative delivery per se has its own disadvantages, its own pros and cons, its own disastrous things that happen to your body. But then where there is no option, there is no option. But in every given situation where you can find an option and there is an option, you should encourage normal deliveries. In this context, I wanted to today talk about induction of labor and normal situations also. Why do you go for induction of labor? So this is one topic that is really which I routinely do on my day-to-day basis. There are certain reasons for it and certain justification points that really are there, because nowadays what is happening is since there is no sitting down, or there is no squatting position, or there are no activities that give you that pelvic floor strength or pelvic floor efficiency and the opening of the pelvis in terms of sitting down, doing chores while you're sitting down, like washing clothes, or squatting while you go to motion, or cleaning of vessels, and all these things usually were done by sitting down and squatting position. So this position was very friendly in terms of opening the pelvis, and there was a lot of room, lot of space for the baby to deliver. Now that we are sitting on chairs and sitting on the couches and doing all activities by standing or sitting, there is a drastic change in the pelvic dimensions, pelvic opening, and pelvic perimeters that is affecting normal delivery. And of course, our lifestyle changes that we have done in terms of shifting the pregnancy age from teenagers and early 20s to about late 20s and early 30s. That is another drastic change that has happened. And this drastic change that has happened has slowly added over the obesity factor. Previously, women used to get pregnant somewhere in the late teens, 18, 19, 20s, and their weight was at about 35 to 40 kgs. But now when they're getting pregnant at 28, 30, 32, 35, their weight factor has come from 35, 40s to 65, 70s. In such given situations also, there is higher body mass index, there is a lot of fat in the body, and fat also causes a lot of obstruction to labor and delivery. Especially when you have higher BMIs, definitely it is one of the factors that cause obstruction to labor and delivery. Not only physically, okay, it is not only physical obstruction that is called dystocia, it is also causing obstruction in a different mechanism, obstruction to normal delivery in a different mechanism, in the way that it causes other medical complications like diabetes, hypertension in pregnancy, and big babies in pregnancy or smaller babies in pregnancy, and these kind of complications deviate the outcome of delivery. So when they deviate the outcome of delivery, definitely you would have a more so operative delivery in need because of the complications. So obesity per se can cause infertility, wherein you go for fertility treatments and end up in multiple pregnancy or end up in some complication in pregnancy. Obesity per se causes diabetes in pregnancy, that causes big baby, or if it is very severe, small baby. Uh, any kind of a fertility treatment or any kind of a you know um, extra added infertility issue or obesity can cause additionally people have hypertension while they enter into pregnancy, or they have preeclampsia or hypertension complicating pregnancy. So in such situations also, either there is a very small baby or either there is a preterm. Other than this also, there are so many lifestyle changes that brought in infections and preterm deliveries and all these things. Over on top of this, stress that adds to lot of muscle stiffness, lot of bed rest that has been given unwantedly during pregnancy. There is wastage of muscle, and your eating habits have gone down drastically. The protein content has gone down. It's only about the carbs and carbs that people are given during pregnancy, and even so, the carbs taste good, so they keep eating carbs and carbs. Nobody is interested in having protein, so that is also causing a lot of muscle wasting. And in fact, the fat intake has gone so high that even the muscle cells have fat deposits now. So it is so bad. And whenever it is in need of contracting during, when you do an exercise or when in labor, it is not very cooperating. So when you have so many varied reasons, these are just a tip of an iceberg. There are plenty of reasons. And you are getting closer to delivery. And if you want a normal vaginal delivery, then we have to be in sync with your body and the baby also. If the baby's head is going beyond the capacity of your pelvis, definitely you will need delivery, because nowadays 3.5 kg is what is an ideal weight to deliver. If the baby is about 2.8 or 2.7 or 2.6, absolutely no worry, you will have a normal vaginal delivery. But then if it is crossing, especially when your sugars are high, when you are when you're diabetic, or when you are higher body mass index and you have a familial tendency of a big baby, all these things matter a lot. And closer to 38 weeks, you have crossed already 3.5 kg. Then how would a 4.5 kg baby deliver in an obese woman by normal delivery? So this is also very important, that throughout pregnancy you're given optimum care, correct amount of diet and correct amount of information that is needed to encourage normal delivery. And when you are well motivated along with your partner, with the help of your partner, when you are well motivated, the doctor can take a call on when to deliver you, especially when you are going towards any complication or towards anything that is taking you away from a normal delivery. The chance of having a normal vaginal delivery, we can assist you with induction of labor. So specifically nowadays, people want vaginal deliveries after a cesarean also. In such cases, we do not allow the pregnancy to go till about 40 weeks. About 38 weeks is the right time. We can check the scar, we can check the findings, and we can promote in a natural way that you end up having labor contractions and pain and deliver. In a similar way, breech also, when you want to contemplate a normal delivery, definitely a smaller baby can go through breech delivery with lesser complications than a big baby. So in such situations also, once 38 weeks or 39 weeks are coming nearby and the cervical findings are very good, usually we induce and deliver them. In a similar way, even for normal deliveries also, now it's COVID and there are so many other complications that once you come in an emergency, you would need additional investigations to go through before entering into the labor ward. So in such situations also, and in situations where your cervical findings are very good, that is the Bishop's code that we say, if the cervical findings are very good and we prepare you 1 or 2 weeks in advance so that the cervix, which is the one that has to open during labor and delivery, ripens, and slowly we take it forward, and one day when we find all findings are absolutely good for you, we ask you to come and get admitted and go through labor and delivery in a smooth way in hospital to decrease the chance of complications, especially in high risk given situations. Low risk low risk people do not have to be dealt in that way, because low risk people, they end up getting into labor, and they usually, if they're around the hospital or somewhere nearby in about a radius of 2 to 300 kilometers, they can come down whenever they start labor, because in the latent phase of labor also, they can, if they can identify contractions as we explain them and teach them, once in early phase of labor also, they can come and even when they have mild contractions, they can reach the hospital, say in about 4 hours time also is not an issue. There are several people that I cater to around 600 kilometers, around 300 kilometers from the hospital, who are booked with us and who are on day-to-day contact with us when they are closer to delivery, and we coordinate labor and delivery even with so much of distance that they are from the hospital, and they safely come in labor also and deliver in the hospital, say in about 6 to 8 hours, even with such distances they stay, because nowadays it's very easy to identify if you are having true contractions or false contractions, and once we establish that it is true contractions, then we ask them to start and come to the hospital. So technology is there, techniques are there, and access is there, so it should not hinder you from getting into whatever you want in terms of achieving a normal delivery. We do on a routine day-to-day basis. We make sure that you deliver safely in the way, in the mechanism that you want to, on the day that you're very well prepared, so that there will be no complications and everything goes smooth as per planned. So this is one of the topic that it is very close to my heart, because on a daily basis also I do something like this called labor induction and deliver them safely in the hospital whenever I feel there is a need for women to be delivered in such a way, especially high risk pregnancy, especially with complications like hypertension, diabetes, big babies, and with fear, who need little bit of assistance, who are apprehensive to land into situations like spontaneous rupture of membranes in the house, and they'll have a lot of panic. So whenever the findings are very good, we tell them this is the right time, get your test done, get everything checked, and get admitted. So in this way, you will set your surroundings, you will set the time frame, you will prepare them, you will always have a safe outcome, because you check their final day blood parameters if they are having less blood, or if there is any specific blood group that is really requiring some backup, you can arrange for blood. You can tell their friends and all, you can prepare them, and a very well planned admission definitely has lots of advantages. And it is not only of the advantages of preparation, it is also the advantages of outcomes. When you have good findings, the outcomes are definitely going to be good. And it is also the way that when we prepare them for labor induction and delivery in a safe environment, the entire team is aware. They go through all kinds of assistance and what exercises are done at what frame of time, what are the dilatation findings that we see, and after which dilatation what kind of exercises to be done, what kind of remedies to be given to them, what kind of relaxation techniques that we should be giving to them. And it's a teamwork, and in this teamwork and flow pattern, everything goes smooth as per plan, and they deliver and have their dream child in their hands within a span of whatever time frame that I usually contemplate it happens. So this is all about managing deliveries in a very finished manner, And also nowadays it is very very important that there are certain customs and certain plans and executions that socially are also putting a lot of influence on doctors and patients, and especially the pregnant women, in terms of family pressure of avoiding unwanted days and unwanted times of delivery. This is what is taking away them from having a normal vaginal delivery, and they are landing up in cesareans. In such given situations, I tell my patients that you should not worry, because if you have a very strong family background of influencing you for an operative delivery, for an auspicious day and time, don't worry. We'll make sure that you will enter that day, or you will avoid a bad day and you will enter some better day. Whatever chances possible to give that outcome, we will definitely try. And what the mother has to have is absolute stress relief. And when we reassure this point, she's also relaxed that she will have a better outcome, because her determination and her source of positiveness is really really important to contemplate a normal vaginal delivery. And this way we even have the confidence of the family members that you should not worry and you should not pressurize her. Whatever will happen good, and there should be no uh, other issues. And 1 minute. So whenever it is possible, we should forward them for a normal vaginal delivery. And there are very special situations like hypertension in pregnancy, whenever there is preterm delivery that is happening and the baby's weight is about 2 kg or above. Always, if you have a very good team to support, you should contemplate a normal vaginal delivery by any method like induction of labor and all these things. Because for somebody with a medical complication, going again through a surgery is definitely more tasking. So whenever possible, in such medical conditions also, when there is hypertension, or when the woman is going through other complications like some liver problems or any for example cholestasis in pregnancy, or any cervical incompetence, or any kind of other issues that contemplate delivery at that point of time, vaginal deliveries are always encouraged, because the complications associated with vaginal deliveries are lesser. But for this, you definitely need a teamwork. Where there is no team, there is absolutely no chance of taking risk, and more so they go towards a operative delivery. But whenever there is a chance, you should obviously give the chance of having a normal vaginal delivery. So it's all about your determination. It's all about teamwork. It's all about catering to social conditions also. It is all about the partner support. It is all about the best of outcomes that we give whenever a planned execution is done. So to encourage normal vaginal deliveries, there are thousands of mechanisms, and to take one decision of a section or a cesarean, it is only one circumstance. So whenever possible, you should always influence with all your knowledge, all your determination, all your planning. I always say that jugaad. So you have to make things together to make that thing work, that is called as a normal vaginal delivery. So in such given situation, you give any given situation to me, I would say that let's do it this way. This way you will have a normal delivery. This way it is going to be more peaceful. This way it is going to work. This way you both as a partner in this pregnancy will see happiness. And leave about rest all things. Rest all things don't matter. You having a safe normal vaginal delivery is very very important in the current given scenario. Whenever situations are bad, when the heartbeat of the baby is not good, or when the baby's weight is too low, or when it is associated with high risk complications, anyway there are situations and conditions where you need an absolute cesarean, you have to go for a cesarean. You just can't say that no, I will deliver normally only. Whenever the situation is not there, you have to go for a cesarean. You have to go for a cesarean. But any given chance for a normal vaginal delivery, you should not leave that chance for whatsoever reasons it is, whether it is a social cause, whether it is a comforting cause, whether it is a time cause, whether it is a fear cause. No. For every given situation, there is a kind of a therapy, there is a kind of a definitive solution, there is a kind of, some mechanism. Even yesterday, I had one woman with a pacemaker on. She's in a second pregnancy. She was not progressing for the fear of having a bad outcome. We induced her because I wanted her to have a safe delivery under the supervision of doctors, and and we induced her, and then she was under the fear of having an operative delivery, and she did not want to take any risk. But then you had a previous normal delivery, and this time why are you getting scared? Her fear was subconscious fear. But then I realized that after about 3 to 4 centimeters, she was not progressing. Maybe her fear was underplaying, and we did not realize that. So I took her up, and we had a dance session for, say, we had dance session for lungi dance, we had dance session for kajrare, and all these small things relieved her of her tension. In 1 hour, we had a normal delivery. And I personally did a session on acupressure. I personally gave her a lot of stress relaxing massage from her neck to shoulder. I will post the videos of this creative thing that we did yesterday. And in fact, she delivered normally at about 2:30 in the afternoon, and she had a very beautiful girl child, and everything ended so nicely. We avoided an operative delivery. And yes, there are situations where your subconscious mind breaks down, and then it doesn't allow normal things to happen. And we can also overcome such situations by some kind of an alternative method, and there are alternatives always in the given point of time. So it was a beautiful experience. I was telling all my staff, this is what has to be done wherever there is a blockage from the subconscious. And they also had a very good training session. So there is a way to have a normal vaginal delivery. There is a way to have your determined skills to show you the result. But you should trust the doctor. I always tell them, I can give you the best of outcomes, but you should trust me. You should not put questions when you have a big baby, 3.5 going to 3.8, and you want to wait at 38, 39 weeks till 40 weeks to enter into labor naturally. You might not have that for your small pelvis that you're having. Your baby weight will go beyond, and it will not come down, and you will have a floating baby for which you have to do a section. So you have to trust your doctor. You have to trust me to give you the best of outcomes of normal vaginal delivery and best of outcomes of your pregnancy. And whenever you are under the influence of only the right person who thinks the best for you, that is your doctor, you will always have a very good outcome. When you are under the influence of many other people and social media and things that are written in Google, not tailor made for you, things that are written in Google are definitely some kind of a thing that is really existing, but whether it exists for you, whether it is apt for you or not, you would not know. It's just general information. Whether the aptness is there for you or whether that thing applies to you or somebody else, only your doctor knows. So it is very, very important that you have to trust your doctor, trust yourself, trust your partner, support your partner to encourage a normal vaginal delivery. Labor induction is not so difficult. Labor induction is not very painful. Labor induction drugs have changed over time, and it is in no injections anymore. There are excellent formulations that take you smoothly through labor and delivery, and they will not have any kind of a extra pinch than having a normal vaginal delivery. So trust me, trust your doctor, and go through labor and delivery in a very smooth fashion, rather than submitting yourself for some unknown fear, rather than submitting yourself for some stupid social reasons, rather than submitting yourself to the fear of somebody else's labor influencing you, fear of somebody else's thoughts influencing you. Give a chance to your doctor, give a chance to yourself, give a chance supporting your partner in such decisions, and enjoy labor and delivery through normal vaginal delivery. That is the need of the hour. Let's encourage normal vaginal deliveries with whatever mechanism that can support vaginal delivery. So, this is all about today's class, and we will go ahead with the next session uh, tomorrow. Yes, and happy Dashera to all of them. And Murthy Garu is watching. Hi, Murthy Garu. And Vijay Dashmi is wants me to explain about Vijay Dashmi today. I feel that Vijay Dashmi uh, is the result of a determined woman. Okay, a determined woman can do anything, and women are the ones who are a base of anything that is called history, whether it is Ramayan, whether it is Mahabharat, whether it is Kali Yuga, Treta Yuga, whatever. Women are the basis of whatever has happened in history, and there is no less for a woman's determination. If a woman can determine something, she will definitely be able to achieve it. This is what Vijayadashmi to me is. It is about Durga, it is about Lakshmi, it is about the power of a woman that can reach to any height in whatever mechanism possible. So it is all about womanhood, woman's strength, and it is about the power of positivity. So that's all for today, and I'll catch you up tomorrow again, yet another session morning.